So good afternoon. You have up to 10 minutes for your presentation, which will be followed by 5 minutes of questions from the Progressive Conservative Caucus. And if you could please state your names for the official record as you begin your presentation.
My name is John Karapita.
My name is Adam Wagman.
My name is Claire Wilkinson.
Okay, thank you, and good afternoon. And as I said, my name is John Karapita. I'm the Director of Public Affairs for the Ontario Trial Lawyers Association. I'm joined by our association president, Adam Wagman, who's the senior partner with Howie, Sachs, and Henry here in Toronto, and our president-elect, Claire Wilkinson from Martin and Hillier Associates in Burlington. So we're very pleased to be able to spend a few minutes this afternoon to discuss our ideas with you about auto insurance reform in Ontario. We've been spending some time discussing our ideas and meeting with MPPs in the last little while, and I want to share with you what we've made clear in those meetings with you and your colleagues, that we're committed to working with you to develop lasting solutions for auto insurance reform. And as we begin, I'd like to quote Don Forgeron, and Mr. Forgeron is the president of the Insurance Bureau of Canada. And just a few months ago, in one of the insurance trade publications, Mr. Forgeron said, and we wholeheartedly agree, that Ontario's auto insurance system has been broken for more than 2 decades. The Ontario Trial Lawyers Association certainly agrees with that statement. Our system is definitely broken and in need of a significant overhaul. And the paper that we distributed to you today, that you have before you, outlines our solution-based ideas for reform. It's the ideas that we put forward in discussions with David Marshall, who, as you know, has been asked by the government to advise on lasting solutions for auto insurance in Ontario. So today we want to touch on the highlights from that document and initiate a dialogue, continue that dialogue with you on the possibilities for reform. And I stress, we think it's time for all stakeholders in this insurance sector to come together and really work together on those lasting solutions.
So we'd like to underscore that it's important that David Marshall's recommendations lead to a long overdue and meaningful debate and discussion about auto insurance. We'd like to see the province return to basic principles and goals of an effective automobile insurance system using simplicity and certainty. The vast majority of people that come to our offices who've been injured in a car crash have no idea what their coverage is. I don't know if all of you know all the details of your coverage, what you pay for in your premiums, the benefits you're supposed to receive, the extent of monetary coverage for income benefits or for medical rehab costs. Most people don't know. And it is a complex document. I meant to bring it with me today. It's thick, okay? It's like it's a big, thick document. And it's been changed dozens of times over the years through all the different political parties. It is complex, and right now, people need lawyers to help them work their way through and navigate this document and this legislation when they have claims. So it might surprise you to know that we're here to say to you that shouldn't be necessary. Lawyers shouldn't need to be part of this equation. And you might wonder why a group of lawyers would come here and say you shouldn't need lawyers. You know, people might think that lawyers are just out there to get business, but we're saying no. You shouldn't need lawyers to help injured people deal with their own insurance company contracts. It shouldn't be that complicated. When you have claims through your extended health policies through work, and say you have physiotherapy or medication costs or whatever, you don't need a lawyer, right? You just submit it through the company. You don't need to negotiate with an insurance company. You just submit it. You don't need to go see a doctor that the insurance company has chosen to confirm that you need the treatment that you applied for. You just get it paid for, right? And what we're trying to say to Mr. Marshall is that Ontario needs to consider that kind of design in the automobile insurance product so that people should be able to just have a relationship with their own insurance company and not need the lawyers. And the lawyers should only come in when there are issues in dispute that can't be managed. It's our position that if we were to move towards a more efficient and streamlined system like that, people would get earlier treatment. There would be less disputes between the insurance companies and the insureds, which would mean reduced costs for Ontario's system because the insurance companies spend an absolute fortune in insurance medical exams trying to verify if people need benefits or not. So ideally, if lawyers could be removed from the system because the system was working on its own in a simple and straightforward fashion, the insurance companies would save money and it would be better service for the people of Ontario.
In addition to simplicity and certainty, what we need is a focus on full compensation for innocent victims, those people who have been injured at the hands of a distracted driver, of a careless driver, of an impaired driver. Now, full compensation for those innocent victims means that individuals who are injured in a motor vehicle accident will have access to the courts to obtain reasonable and only reasonable compensation for their losses. And that's what's currently the case, by the way, in case you're wondering, in BC, in Alberta, and in the Atlantic provinces, without artificial constructs in our regulations like a threshold, a deductible, limitations on being able to recover your actual out-of-pocket expenses, whether it's for medical treatment or your loss of income. The reason is that the tort system is a far more efficient system than the accident benefit system. That's been proven over the years. It involves far less in the way of the transaction costs that Claire was discussing. It's not susceptible to the kind of misuse that we often hear alleged to exist in that no-fault system. Within the tort system, there's none of those forms to fill out every single day. There's no daily submissions and paperwork that an insurance adjuster has to respond to within very short time frames. And there are significant repercussions for bad actors. The reasonable expectations of consumers that they can recover what they have reasonably lost at the fault of a careless driver will be met. And that's not currently the case in Ontario. Personal values will be protected. And at the end of the day, it's up to a judge and jury to decide what constitutes fair compensation for that injured person based on the evidence. Now, in the most recent Fisco 3-year review on auto insurance, the report concluded that the bodily injury model in use in Alberta, New Brunswick, Nova Scotia, and PEI, which has some caps on pain and suffering for minor injuries, but broader access to the tort system for other damages, combined with modest accident benefits, appears to have contributed to lower costs and premiums in those jurisdictions. That was the conclusion of the Fisco report. And accordingly, other systems in Canada should be used as a model for Ontario, which should lead to a fair and affordable insurance product. Now, here in Ontario, we frequently compare our auto insurance system to others across the country, and people ask us all the time, how does it compare? Despite what you have heard and what you have been told, far from being the most generous system, we have fallen woefully behind other jurisdictions in this province. Our system is terribly broken, and we could do far worse than replicate what other provinces have in place. In closing, I want to thank you all for listening patiently. We're eager to answer any questions that you have, and we're most eager to work with all of you and all of the other stakeholders to find solutions for our auto insurance system that benefit all Ontarians. Thanks for listening.
Thank you very much. We start this round with the Conservatives.
We thought it was you guys.
We started the last, the expert panel started with the Liberal caucus.
piece and it goes back
All right.
here, right?
As the committee wishes, all right?
We'll take questions from whoever's asking.
Yeah, you only get one caucus at a time. All right then, the Liberal caucus.
Okay. Well, thank you very much for your presentation. And I sympathize with some of the discussion about dealing, having to deal with issues with insurance. A gentleman came into my office and he has no living relatives. So he came in and I thought, this is a little frivolous, but there was a $12 cost on his insurance that is for money to go, if he's in an accident or he's killed, to go to compensate families, $12. And I guess that's on everybody's. And he said, I don't have any living relatives. I don't want to pay that $12. I can't tell you how long it took us to get him his $12 back. But it is ridiculous, and I wonder how many people are like that they're getting charged for something that in no way can they ever benefit from, and they really shouldn't be paying for it. In regards to Mr. Wagman, you were recently quoted in the Toronto Star agreeing that referral fees are becoming a problem. Can you tell the committee how this practice is impacting consumers and what you propose as a solution, please?
Sure, happy to. We've been working with the Law Society on that very problem. One of the things that referral fees has done is, frankly, funded a lot of the advertising that you see around the province for personal injury lawyers. We'd rather see that money go into the hands of accident victims than to be used for advertising purposes. But on the other hand, there needs to be a reasonable system in place to make sure that the cases get into the hands of the lawyer who is best suited to assist that. So there's a balance to be reached.
Right.
And we've recommended a balance that would cap referral fees at 10%. That is 10% of the fee that the lawyer charges to their client to be paid to the referral source. And our organization thought that was striking the right balance. And back to your point about that individual who's paying for something that they don't need, what's happened in Ontario is that we've gone to a system that has more optional benefits in place. And our vision would be a scaled, as Claire discussed, a scaled down, easier to access accident benefit system, but one that also has those optional benefits available for people to purchase what they need. Optional benefits are only useful if consumers are informed about optional benefits. I would ask you to put up your hands if you have any idea what the optional benefits are currently here in Ontario, but I'm not going to embarrass all of you who are not going to put up your hands. And the reality is the problem with the optional benefit system that exists now is nobody knows about it. So if insurers and brokers, and frankly to some degree the government, does a better job of getting the word out, then we can get a system in place that is streamlined, that is less expensive, but that also provides benefits to those who need them.
This gentleman was told that it was the government that said that he had to have it, which after looking into it, that was not true. He was told it was the law, and it was not.
Yeah. Well, so, unfortunately, many consumers are misinformed by those who they ask about insurance.
He was sure
issues.
that we were going to fix this for him, and we did. So, but if he had not been persistent, we wouldn't have been able to do that.
And if he wouldn't have had an advocate who was willing to spend likely more than $12 worth of time on the $12 issue, then he probably wouldn't have gotten a response.
Thank you.
Okay. Thank you very much for your presentation this afternoon. If there's anything further in writing you'd like to provide to the committee, you can do so until 5 p.m. on Friday.
We will do so.